Hi, everyone. Good afternoon. My name is Christine Allen, for those of you who haven't met me yet. I am the president and co-founder of Act Now Foundation, and we are a dementia resource center based here in northern New Jersey. We, as an organization, are a nonprofit, and we provide supportive services to families who are living and struggling with Alzheimer's disease and related dementias. And one of those programs that is really important to us is our educational series. So right now we're in week 2 of our 4-week session. Last week we focused on sort of the basics of Alzheimer's and related dementias. This week we're going to focus on depression and social isolation in older adults. However, again, since we are based about dementia, if you guys ever have any questions going through this presentation about Alzheimer's disease or related dementias, or maybe anything that I didn't hit on last week, please feel free to just raise your hand and let me know. This is very casual, okay? You don't have to wait till the end of the seminar to ask me a question, all right? But before we get started on this presentation, I want to ask you guys, how many of you felt like during COVID, right, the last 2.5 years, that you were suffering from some form of depression and or social isolation? How many of you felt socially isolated during COVID? For sure, we all did, right? Doesn't happen just older adults, but we all really felt socially isolated. Do you feel like that affected you emotionally? Absolutely, right?
And I work before, but still not the same, like even at work, seeing the see you makes the day go by faster, talking to them.
We didn't really realize how important social engagement was to each and every one of us. So that was a rude awakening, I think, in the history of what we're going through. So we're going to go and try to. I got to turn it on. Okay. Oh, it just beeped. Should work. Yes, it worked. Wow, technology is wonderful. So if you look at this first slide, what is depression? Okay, depression. Can you see? Depression is actually a serious mood disorder. Okay. It affects most older adults it affects the way you feel, you act, and you think, which is surprising, right? Sometimes we feel like depression may only affect how we feel, but it also clearly affects how we act. And although it's common, you should realize that it's not a normal part of the aging process. So this is something that we need to start discussing. You know, the issue is that most older adults do feel socially or feel satisfied with their lives, despite having more illness or physical injuries maybe than our younger generation, right? Most of us do feel relatively satisfied, with the exception of what we went through in the last 2.5 years, right? So that's why we want to talk about this today, because we want to start having an open conversation about depression, okay? So now here's the interesting thing. And if you were here last week, you would have realized that depression is actually a risk factor for you developing dementia. Now, if you look at the symptoms on the left in the light gray, those are symptoms of dementia. If you look at the symptoms on the right-hand side, those are symptoms of depression. But you see that the ones that that coact, that come together in the middle, those are actually symptoms that are on both dementia and depression. So when someone is suffering from depression, you may actually feel like or be concerned about the fact that you might have dementia. And it might be true. So it's the reason why we also as an organization talk about early detection. So when you are suffering from symptoms of depression, you really do need to go to a doctor to get evaluated, to talk to, because it could be signs of dementia as well. So we've gone through the signs of dementia before. A slow mental decline. You know, the difference with dementia is your cognitive abilities decline. They get progressively worse over time, right? It's not something that's sudden, that just changed from yesterday to today. No, it's something that is chronic and that happens slowly over time. The confusion and disorientation. You have issues with writing, with speech, with language. Difficulty with short-term memory, that's where it usually starts in our hippocampus, which is the center where we hold our memories. It's also where we hold our short-term memories. And then you don't notice memory problems or seem to care. Now, a lot of people that develop dementia, some percentage of them don't actually realize what's happening to them. Others do. And remember what I also said, that not one person has the same journey when they are developing dementia. Everybody is very different. So there will be those people that develop dementia and they don't realize that it's happening to them, which makes it a little bit more difficult to diagnose, especially in the beginning stages of the disease. With depression, it's a more rapid mental decline. So if you, over a short period of time, a week, 2 weeks, start to develop a mental decline that happened relatively quickly, that could be depression and not dementia. Okay? You know the correct time, date, and you know where you are. Okay, so you're not suffering from the confusion or disorientation, that's the difficulty, but you do have difficulty concentrating. Now, I know a lot of us have difficulty concentrating, but when you feel like you're focusing on one thing and then your mind drifts onto another subject and then onto another subject, or you go from one task and you quickly change to another task, that could be a sign that there is something more going on, okay? You do have language and motor skills are slowed, but they're still normal. So you're not going to react as quickly maybe as you used to. And you do, of course, you have a high level of worry, and then you also have a high level about worrying about memory problems. So someone who's suffering from depression worries about memory issues. Some people suffering from dementia don't worry about the memory issues because they're not aware. Okay, so now look at in the middle. Our memory problems fall both into dementia and depression. Our sluggish speech and movements, difficulty getting out of bed, you're sluggish in moving, you're much slower than before, your mind isn't able to focus as easily. So that could be either dementia or depression. And then low motivation. Remember, depression is a huge risk factor for dementia. So again, these are things that you're going to notice in the symptoms in the beginning stages. Now we have many different types of depression, okay? I know. We have the major depressive disorder, okay? This lasts at least 2 weeks. It interferes with your ability to perform daily tasks, and it's a chronic issue. So major depressive disorder is chronic. More than likely, it's something you've been suffering from since you were younger, okay? Now, persistent depressive disorder, or dysmia, lasts over 2 years, but you're still able to perform daily tasks. Now, a lot of times people that suffer a trauma in their life, you lose your spouse, you lose a child. You can most definitely be suffering from persistent depressive disorder, and it can last for years. But you're still able to get up, you go to work every day. Some people might not even notice that there's anything going wrong. I don't know if you've just heard, we had a newscaster in Atlanta, Georgia, over the weekend who just committed suicide. She was someone who got up every day and went to work. She was smiling, she was happy, she put on a whole persona, and she committed suicide over the weekend. So this is something that was persistent for her. We also have depression that's associated with medicines and or alcohol, especially when we talk about pain meds. These are types of things that sometimes people use them to ease their pain, but what it eventually does is make things much worse, right? And then we have depressive disorder due to a medical condition. So this could be due to multiple sclerosis. It could be due to Alzheimer's disease. So for those people that develop Alzheimer's disease, quite often, when they're aware of what's happening, they can develop depression. I mean, obviously, you've been diagnosed with a chronic terminal illness. So you can develop based on a medical condition, but it could also be due to the disease itself. So dementia affects our brain, right? It affects our brain cells. It affects the brain cells in the area of the brain that control our emotions. So if that hits the area of the brain that controls your emotions, it could trigger depression. Okay, so it could be a risk factor, but it could also be caused by the disease itself in Alzheimer's. But people who become depressed late in life have a 70% risk of developing dementia. And I want to tell you something. How we deal with trauma is a key indicator on whether or not we develop depression. So it's about learning how to develop coping mechanisms, right? Those become very, very key. And if we need to reach out for help, we should reach out for help. If we need to start having a conversation, which is why I'm glad to see a good number of people here today, because that means we're all having a conversation about it, right? And then what we learned today, we can take out of this room and we can take it into the real world, into our real world conversations with our friends and other family members. Yeah.
My end with seniors, when I work with them, my manager gets mad at me all the time, I don't care. I'd rather sit and give a senior 15 minutes of my ear than to catch up on paperwork. That could be
Absolutely.
saving life.
You better believe it.
And our company, we had somebody who was in the building. So.
Yeah.
And my dad suffers from mental health.
Wow.
Like, to me, when it comes to paperwork, I will put that away. And I will give the seat in my ear and listen, because that to me makes a difference, especially after COVID.
Absolutely. And you hit on a really key point. It's giving your ear. Okay. It's about just taking that extra moment in time to listen to what somebody has to say, but it's not just listening. It's really learning what they're saying. It's responding then to what they're saying, but it's listening. You have to hear the words that they're saying, right? Rather than just giving a generic, oh yeah, really? No, you really want to listen. And you probably do make more of a difference than you even realize. Seriously. So we have talked about some risk factors, but here are risk factors for depression, okay? And when you look at a lot of these risk factors, you're going to see, for anyone who came to the seminar last week, that these risk factors overlap with risk factors for dementia. So if you look at medical conditions such as a stroke or cancer, is a huge risk factor, but a stroke actually can cause vascular dementia as well, right? So family history and genetics. There's also a genetic component to depression, especially someone who's suffering from chronic depression who has developed a mental health issue their entire life. That can be family history and genetics. Functional limitations that make engaging in activities of daily living difficult. So if we had for instance, I'll tell you my personal story. My niece, I think I mentioned it last week, 24 years old, had a stroke, and she has lost the ability to walk pretty much on her left side. Her left side is her dominant side. She lost the ability on her left side. She is now suffering from depression, rightfully so. She has a trach, she has a feeding tube. 24 years old, you just had a baby. So these things can cause chronic depression in us. So again, what did I say? It's about how we deal with that trauma, how we cope with that, how we learn to move forward. That will depend on whether or not we can develop dementia. So also stress, we know stress. Again, we need to learn how to cope with our stress. Having experienced depression as a younger person, so that already puts you at a risk for developing chronic depression. It also puts you at a risk for developing dementia. Sleep problems. I am going to talk about sleep all the time because sleep is key to our brain health. Sleep is key to a happy brain. Sleep is key to a brain free of dementia. It is important that we get a good night's sleep. Okay. So what's really important is I tell people, try to create a routine that you go to bed at the same time every night, you wake up at the same time every morning. You know, you're obviously trying to eliminate alcohol and caffeine as you're going to bed. We need to get those 7 to 8 hours. We need as much deep sleep as we can, because that's when the brain has that natural flushing system that flushes out not only the plaque buildup in the brain that causes dementia, but it's giving your mind an opportunity to sort of recover from your day, right? It's very, very important. Social isolation and loneliness, of course, and that's why we're all sort of here today. What COVID taught us is that we need to start having these conversations, because even people that never suffered from depression ever in their entire life have now had issues because of COVID, have now had issues getting back into the workforce, right? Getting back into real life. How do we do that? So we need to talk about that. Lack of physical activity. Yes, I'm gonna tell you, physical activity gets the body moving. It gets your adrenaline flowing, which it builds oxytocin naturally within the body, right? Which is your adrenal gland is on fire and you're happier and you're relieving that stress, right? And you're keeping the body healthy, which keeps your mind healthy as well. So it's a key. I know sometimes, of course, if you're suffering from depression, it's hard to have the motivation, right, to get up and go work out. Even if I'm not suffering from depression, it's hard to have the motivation to get up and go work out. So, but it really can, if you take that first step, it can make a difference in how you feel. Yeah.
I noticed, like, I was an only child, and then with COVID, you could do about everything, just sat there and thought I was
Right.
about break. But being an only child, and I would make myself go to school and get perfect attendance because there was nobody there. Mom had to go to work, but she was home half the day, dad was work. I'm like, I already felt like you can't be here by yourself. You must go to school to talk to people.
Yeah. But that was just you naturally in your mind. It didn't feel normal for you to
Yeah.
be alone. It felt normal to be with people. And that is true. We are social animals. So we naturally want to be around others. And if we don't want to be around others, then that's telling you something. Okay? That's a warning sign. That's telling you that something's not right.
What's the name of the condition, for lack of a better word, when someone becomes paranoid or stressed out about going out in public? When they were younger, working and functional,
Yeah.
then like my dad. And then it's like now, it's like pulling teeth to get him to get out of the house.
Yeah, to leave the house. Social anxiety for sure, but I think it's agoraphobia.
Yeah.
Yeah. There it is. Got it. Agoraphobia. Yeah, that's a big issue. And that's what I'm saying. You know, after COVID, people are afraid. We had our whole world inside. And now to step back outside, especially for someone who was already maybe on the verge of having social anxiety and then having to go through COVID, could really puts people back. And we're still fighting to get through that. But you know, that you need help. That you need to see a psychiatrist or a therapist to help get you through that agoraphobia. There's a lot more to it than just that. Yes.
And now it's like the war in Europe, like, you know, and kind of feel like, oh, I'm gonna be meeting migrant people, I'll be meeting with people, new situation, COVID out of war, like.
Well, yeah, and then we're all, you know, there's so many gun violence happening out there in the world too, and then people are concerned about, oh my God, am I gonna walk into the wrong place at the wrong time? These are legitimate concerns that we should be worried about, but we shouldn't let us stop living our lives. And if it is preventing you from living your life, then that's a sign that you need to talk to somebody about it. Okay. Social isolations. We're going to focus a little bit more on this. It's the lack of social contacts and having few people to interact with on a regular basis. Okay. Loneliness is totally different. So loneliness is the distressing feeling of being alone or separated, even if you're in a room full of people. Okay, so again, both of these issues are concerning. We have to be concerned about social isolation and loneliness. And most people suffer from loneliness at one point or another in their life, whatever the reason is going on, but it still needs to be addressed. Over a quarter of seniors do not see or talk to other people for 6 days a week. And that was like pre-COVID numbers, you know. 6 days a week, they're alone. Most people are staying alone in their home for 6 days a week. They don't interact with anybody else. Isn't that incredible? What this also tells you is that if you live in a building with lots of neighbors, or you have neighbors around you in your house next to you, you know, be a good neighbor. Check on them. Just like you just said about having a good listening ear, just a knock on the door that says, hey, Mrs. Smith, I just wanted to say hi, how are you? And even if it only took you 1 minute, can make the difference in that person's life, right? Older adults are at a higher risk due to changes in our health. Again, because again, if we have a physical disability or a mental disability, again, that gives us reason to be depressed. So we think that's why we're at risk. Social connections, lots of changes, right? As we age, we're losing the people that we love. we're losing our spouses, we're losing friends. That can cause depression. We're losing our hearing, we're losing our vision. So when we start to lose our hearing and our vision, we start to socially disconnect from others. And that's a huge risk factor for not just only depression, but dementia. So I would say if you need hearing aids, please make sure you wear them. What people don't realize, if you can't hear what people are saying, you're going to lose your ability to comprehend conversations as a whole. Because you're not engaging in a conversation any longer. You can't hear, you can't understand. You're not engaging because you don't want people to realize that you can't hear. So you're actually, over a long period of time, going to lose your comprehension. So again, you're at risk factor for dementia. You also, changes in our memory loss, is depressing, changes in a disability. Again, if we develop a disability after a stroke. Also, we have very good statistics that state immigrants, LGBTQ, members of the LGBTQ community are at higher risk as well. Again, because we are social isolating either ourselves or social, the world outside is separating us into a certain category, right? And then that could keep people from engaging with others. So we're at a risk. Social isolation, like I said, is associated with a 50% increase in developing dementia. 50%. Right? How scary is that? That's a really scary thought. So it's about, we really need to basically keep ourselves engaged. I always tell our older members of the community, join a senior group. I mean, I love playing bingo right now. I mean, I'm 55, I'm technically a senior. I don't know, I used to be 55, but they keep raising the number. They keep raising the number.
55, then it gets to be 4.
I know.
You get the coffee discounts, I think.
Yeah. But it's about getting engaged. So I always tell people, go join a senior group, find one that works best for you, because that is your network of friends. That's your natural social engagement. It's a great idea. In addition to social isolation and loneliness are also associated with risks of impaired thought process. Remember, if you're not engaging with others, you're not engaging in conversation, you're losing your ability to have a conversation. You don't use the skills you have, you don't use it, you lose it, right? Okay. Accelerated cognitive decline, worsened immune systems. And I'm going to tell you something too. It puts you depression and social isolation. You're probably not eating right. If you are at home alone, you don't want to go outside, you're probably not eating a healthy diet. You're probably not eating enough healthy foods at all. Okay. Cardio, which also increases your risk for cardiovascular disease, heart issues, an increased chance of early death, and an increased risk of depression. All from lack of socialization. Isn't that amazing? But we don't realize it, but it's really true. And I think more people realize these now after COVID. Now we're seeing more and more. We're seeing more older adults commit suicide. Because we're not having these conversations. Okay.
To me, it's funny how cancer, AIDS, lupus, all that stuff, anybody can talk about it without an issue, but when it comes to mental health issues,
We don't want to talk
even
about
like that.
Yep.
If he was to know half the people that I talk about, his issue and how I dealt with it, what it's done to me, he would be like, what's wrong with you? Because he's part of that generation that's like, what happens in the house stays in the house. And I feel like that generation is the one that's up now.
Yep,
From
facing
the
it.
depression and the dementia.
But you know what else you have? You have a cultural issue of stigma associated with any mental health issue, including Alzheimer's and dementia. So again, we're not having these conversations. So yes, it puts you even in greater risk. 43% of seniors feel lonely on a regular basis. Lonely. Remember, there's a difference between depression and loneliness. Okay, so lonely is right now. Any one of us right now. We're in this room, I'm smiling, I'm happy, right? I'm putting on this presentation. I could be suffering from loneliness right now.
I was gonna say, It's back to school time, and I said to myself, don't call anybody right now, because they're getting your kids ready. Like, whatever you might need, or you might want a ride to Walmart, don't do it this week.
Oh.
So mid-September.
Well,
then doing the kids. And
that was
this and
thoughtful.
that, And I know I'm older, so, they're getting ready.
Exactly. Well, that was thoughtful of you. Signs and symptoms of depression. Okay, so these are the things that we can start to look for within our own. Yes? I'm sorry, say that again? Loneliness. Well, so good thing, good question. Loneliness on its own, because typically loneliness is something we work through. If we don't work through the loneliness, it turns into depression, and then depression can cause dementia. Loneliness, if we let it affect our ability to socially engage with others, if we let the loneliness affect our abilities to take care of our activities of daily living, then yes, it could be a risk factor for dementia, if we let it. But it doesn't have to be. Where depression, on the other end, chronic depression, is clearly a very big risk factor. Okay, so loneliness can develop into depression, which then can develop into dementia. That makes sense? It could be a catapult effect. So it's important that we deal with that loneliness and we step out. Okay. Question? No. Okay. So signs and symptoms of depression. Again, first and foremost, feelings. Yes. Question? No. Feelings of hopelessness, guilt, and worthlessness. I mean, I think that we've all suffered from some of those at some point in our life, but again, it's about what? How we deal with it. Okay. Irritability and restlessness. Again, can't fall asleep, can't stay asleep, constantly up and down. That irritability, most people underestimate the changes in our personality when it comes to depression and dementia. Don't underestimate how maybe, you're really easygoing and then all of a sudden you're really irritable all the time. Even you can't explain it to yourself. Like, oh my God, I just really bit my husband's head off. Yes.
I think people are quick to say, oh, he's a grumpy, and
Oh, he's having a bad day.
they were characterized. Grumpy when it might be depressed.
Absolutely.
Or might be something that's
Or lonely, yeah. But here's the thing. I mean, as family members, this is what we have to pay attention to. Is it chronic? Did it just happen once last week? And then what else was going on in his life, right? Was there a trauma that occurred that could just mean a temporary sign of irritability, So there's a lot that goes into it, and we need to watch out for, we need to look at what else is going on in the big picture.
I have a senior in my building. She is very spicy.
Good word.
When I say spicy, I'm talking about like full jalapeno in this little cat. Like she's spicy. And she understands English, understands Spanish. She used to be, I believe it's called the non-discerned court system.
Yeah.
And I feel bad for her because she has like a niece or nephew in Florida, but she doesn't have regular people to visit her. And because she's so spicy, she usually pushes people away. Right? I want to help her because I want to get to a point there. She's 92.
Yeah.
And still.
Has she always been spicy?
Yes.
So, okay.
Yes. And the older she gets, this me in particular, she's like, she cannot stand.
Yeah.
But I'm a social worker in the building, so I want to get to her because she has no one. I know there's social services that she needs.
Mhm.
But it's like every time I try to confront her, okay, I'm gonna say this name. Maria, I need A, B, C. Well, I don't want A, B, C. Well, then I can't get you the help that you need. And it's like a constant battle. And I try to look past it. Is there any suggestions with working
Yes.
with the elderly person that you can give me to try to get around that?
Okay, here's the issue. You can't say, Maria, I need A, B, and C. You say today, Maria, I need A. And leave it at that. Okay? Doesn't matter if it's gonna take twice as long. You know who you're dealing with, somebody who is, she's a fighter and she wants to make everything difficult. Okay, that's fine. Today, Maria, I need A. why don't you come up today to come down to my office whenever you have a few moments, whenever you have time, we'll sit down, we'll do A together, and then we'll move on. And then maybe when you're done with A, say, oh my God, you know what, I completely forgot, I need to get B. What do you think? Do you have time to do that today? You know, so you just have to talk to them in their, and the level that they can accept, right? So it's the same thing we say with people with dementia. We never ever say to someone, hey mom, okay, here's what we're gonna do today. We're gonna get up, we're gonna take a shower, then we're gonna have breakfast. And then I thought maybe we'd go take a walk. But what do you wanna wear today? Like, what do you think you should wear? What do you think? You wanna wear a dress? You wanna wear pants? I mean, what do you wanna do? Well, I've lost them at word one. It's about taking one thing at a time. Okay, simple steps, one thing at a time. So that would be my suggestion. Obviously, other signs of depression is when we have decreased energy. Okay, if we're moving slowly or we're talking more slowly, we're not, again, having those broad, big conversations, we're definitely not debating anyone. Okay, we have difficulty concentrating, remembering, or making decisions. And this is why sometimes when we have these symptoms that are first coming out, we don't know whether it's dementia or depression. Remember the overlapping symptoms, okay? So this is something we have to pay attention to. Definitely difficulty sleeping, eating more or less than usual. Everybody's different. Some people deal with their pain in their life or their loneliness or the social isolation by eating. I know during COVID, I gained 10 pounds, you know, what do we call it? The COVID 20, I think. Like, remember how we used to say the college 20? Whenever you went to college, you would gain 20 pounds. The same thing happened during COVID. And then, of course, worst case scenario is when someone has thoughts of death or suicide. And hopefully they have people in their lives that are seeing all these signs prior to that. But again, it's happening more and more every day with people that you would have never imagined. So it's really about looking underneath.
Yes, how, like my generation, from like Queens, New York, they all want to run away to retire, but you're isolated. When you go to North Carolina, and there's nobody there but you and your spouse. That sounds like a bad idea. Maybe you have to stay closer.
Yeah.
Where you have friends. And
It's a very good point. I mean, you know, people do want to run away, but then they have to realize they're running to something brand new, which again could be upsetting, a brand new situation. Then you don't know anyone. So are you the type of person that can get to know people and engage in the community? If you're not, it's probably not a good idea to pick up and move.
But this, it sounds good. Oh, it's great. It's cheaper. You know, like my friend said,
Yeah, but do you know what are you going to do when you get there? Because then if you're not doing anything, you're not going to socially engage, you're at risk for developing depression. So yes, good point. Do you know that women are almost twice as likely as men to have depression, to be depressed? And I think I say this all the time. I mean, women, we carry a large burden on our shoulders, right? We're typically the caregivers. We're taking care of our kids. We're taking care of our parents. There's a large burden. We have a lot of loss that we have to deal with. So I think that's part of the picture there. So depression in minorities. So this is what I was talking about a little earlier. It's really interesting. African Americans are half as likely to receive treatment than Caucasians, and 24% of Hispanics with depression and anxiety receive appropriate care compared to 34%. And this goes back primarily to the first thing that we were talking about, which is the stigma associated culturally with depression. So, and also with dementia. Culturally speaking, people of Hispanic background, African Americans, we're not having these conversations. We're keeping it to ourselves. If we're fighting depression or memory loss, we're not telling anyone because those are not things you discuss. It's not only generational, it's also cultural. Okay, and they go into this here. Sometimes it's a lack of access to services and higher rates of poverty and no health insurance. We feel like we can't go out and ask for help because maybe we don't think we can afford it. But again, this is about, if you talk about it, there are programs and services available out there. Cultural and language barriers, and so where you live, and again, having access to doctors. Limited research concerning mental health in minorities, there always is. I mean, we have limited research concerning Alzheimer's disease in minorities. We have limited research on testing clinical trials with minorities in the fight of Alzheimer's. It's something that we're fighting a lot. Cultural beliefs on depression, there's that stigma. Okay, number one reason why people do not seek help is stigma. Whether you're white, Black, Indian, Asian, it does not matter. Stigma is the number one issue why we don't reach out. Symptoms of depression may vary depending on your cultural background and belief. African Americans also experience sleep paralysis. So we have sleep issues.
I remember that.
Did you?
Oh, yeah.
So
It's crazy.
it's
But I
great.
grew out of it.
Well, that's good.
So maybe because I was adopted, like trying to adjust and stuff,
Maybe.
I'd be sleeping, you kind of wake up and you cannot move.
Wow, that is unbelievable.
I grew out of it.
Yeah, well, that's a good thing. I'm glad you did. Some Hispanics experience symptoms of anxiety that include uncontrollable screaming, crying, trembling, and seizure-like fainting. And I think that is not specific to just Hispanics, but that's anyone who has seizure-like disorders. Okay. Sometimes Chinese people experience bodily discomfort and feelings of inner pressure and symptoms of pain, dizziness, and fatigue. Again, these are all things that are risk factors, culturally speaking. Okay. So now let's talk about something a little happier, right? Let's talk about things that we can do for someone who has depression. Okay. So we want to talk about 5 things that you can do. Number one, it's always important that we encourage the person to seek medical treatment, right? And there's many different ways of medical treatment. I mean, nowadays, what I kind of loved about COVID, these apps that came out, these therapy apps that came out on your smartphone, these people that literally, because sometimes you just need, sometimes it's difficult to get out of bed, right? Find a doctor, make that doctor's appointment, get in the car, get to the doctor. Well, you know what? Things have changed now. You'll use our technology. But sometimes we just need to talk to someone for a few minutes. So those therapy apps are great. Participate in activities the person likes to do. So again, if you're living with someone who's fighting depression, it's about trying to get them engaged in the activities that you do know that they like, but do it with them so that they're not doing it alone. Help set up medical appointments. This is a big thing. I think every person who's fighting a chronic illness, including even depression, needs an advocate, right? You need someone to help advocate for you, and help you make those doctor's appointments, help motivate you to get to the doctor's appointments, okay? Healthy eating. I know last week I always say, you know, eat right, work out, eat right, work out. It's so like, duh, I know that, but remember, a healthy diet can reduce your risk factor for dementia by 35%. So we cannot underestimate the power of healthy food for the brain, okay? And then ask if the person wants to go for a walk. I told you, physical activity is a natural mood booster. And that sometimes that's not, you don't have to go to the gym and run 5 miles. Sometimes that's literally just getting outside, taking a walk, even if it's a slow walk, getting that natural vitamin D. That's also a natural mood booster into your body, okay? Steps to prevent depression. So again, this is a reminder, this is actually how, because guys, we could develop depression at any time in our life. It can happen to anyone depending on what we're going through in our life, right? A severe trauma. I mean, and I think I told you, and I like to talk about things that I'm going through, so I'm sharing with you too. My aunt died 2 weeks ago, very, very tragically, in a very horrific manner. My other aunt died a week prior to that. My uncle 2 weeks prior to that. My father is in the hospital with stage 4 cancer and Lewy body dementia. And then my niece that I told you about that had the brain rupture, all within 3 months. I mean, I literally said, God, what are you doing? Why are you testing me in this way, right? So how I'm dealing with it and why I'm talking to you about it, because me talking to you about that right now is helping me, right? It's helping me make it like I'm coping with it more when I talk about it. So it's important to do that because you have no idea. So this could happen. I've never had a depressive thought in my life. Have I ever been lonely? Sure. But until now that I went through all that, I I can see how trauma like that can push somebody over the edge. So it can happen to us at any point in our life, okay? So we do want to try to eat a healthy, balanced diet. I talk about the MIND diet, which should be in your exit package. Anything that's good for the heart is good for the brain. All right, there's also new studies that the keto diet is a great diet for your brain. So keto diet is about reducing, it's about a high fat diet, but it's about reducing carbohydrates and sugars. What did I tell you before? I told you this before last week. Alzheimer's is classified as type 3 diabetes. That is how close the relationship is between our sugar and insulin levels in our body and Alzheimer's. Okay. Get 7 to 9 hours of sleep each night. I really say 7 to 8. Okay, 7 to 8. I know, but this again, it's about training the brain. You can do it, guys, you can do it.
I, with anxiety and everything
Yes.
going on at work and my dad.
Yeah.
I lay in bed and I'll stay in bed. I don't get up.
Yeah.
But my brain is just like.
Well, let me tell you, you know what I do now? Because I have sometimes trouble shutting life off, right? How do I shut life out when I'm going to sleep? They actually have these eye masks that I bought on Amazon. It's an eye mask, but within the eye mask, so I also like complete darkness. I also wear earplugs. Complete silence and darkness. But now with this new ear mask, it's got audio inside. I can play white noise. So I play like the sounds of the beach. And it's only in my head because it's on my eye mask. So it puts me to sleep and helps get rid of the life's worries that we all think about as we go to sleep at night. And it helps you get rid of them. It's really, really important, but you have to train yourself. It doesn't just happen like that. It is training. It's about learning how to control your breathing, learning how to relax every muscle, starting from the top of your head to your tip of your toes, slowly going through breathing slowly. I'm listening to the white noise or the ocean, and I'm relaxing every single muscle in my body. It's actually a trick that they use that in war, people in combat use it to try to fall asleep whenever they can, even if they're on the front lines, they're trying to fall asleep. How do you sleep? But think about it. They need to do that. So it is possible to train yourself to get more sleep. Stay in touch with friends and family. Okay? Don't always wait for somebody to reach out to you. Social engagement is a two-way street. Okay? Participate in activities that you enjoy. And if you don't know of an activity you enjoy, find an activity you enjoy. Okay, and that's the great thing about joining a senior center is they have so many different types of activities, things you might get interested in. AARP has many senior centers throughout the state. So you can find an AARP group, which they do a lot of great and interesting things. We're actually doing a program with AARP and the Smithsonian from Washington, D.C. in November. So I'm going to make sure that we'll get information out to you guys all about the program we're doing. It's going to be a really great new program. Okay, and let others know when you're experiencing symptoms of depression. I know that's a hard one. That's a hard one. How do we let people know? Because again, we don't want to talk about it ourselves and we're afraid of the stigma, but you know, just sometimes reaching out it's hard, but it can be done. Okay. Late life depression affects about 6 million Americans aged 65 and older, if you can believe, but only 10% get treatment. So there you go. This is the reason. Only 10% actually seek treatment because again, we don't want people to know. We don't want to talk about it. So there are treatments available, and some of the different and new therapies that have come out into the light right now. Cognitive behavioral therapy. All right, cognitive behavioral therapy can mean many different things. But it's a short-term solution, but it does help people problem solve. So it's about learning how to rewire your brain. That's the best way to put it. Okay, so it's talking about reveals the relationship between your beliefs, your thoughts, and your feelings, and behavior that follows because of those beliefs. So you need to rewire your brain, and it can be done with cognitive therapy. Interpersonal therapy usually lasts around 12 to 16 sessions. It focuses on the impact your interpersonal relationships and social interactions have on your mental health. And we underestimate the power of those interpersonal relationships. Okay. And then antidepressants Nothing wrong with it, guys. Antidepressants, just because you're on an antidepressant doesn't mean you're never gonna come off of an antidepressant. That's what people think. And you shouldn't think that, but if you need it, where people are suffering from chronic depression, sometimes that's the only way out. You know, the problem is that people that want to start an antidepressant program, it's not a miracle drug, it's not one drug. There are many different medications out there, and it's finding the right one at the right dose, right? That works for you. And again, there's no rule of thumb, not one thing works for every single person. So that's why a lot of people tend to back off of it because they think it's just not working. Well, if that one's not working, then let's find something else that does. And that's when you have to work with your doctor. Okay. And self-help for the elderly and depression. Oh, look at the kitty. That's the best thing ever. A companion animal. Don't underestimate it. Oh yeah. I mean,
I've never home, so I can't really.
I know, but you know what? I don't have a dog, but my dear friend has a dog, and I feel like I'm the second dog's owner. So when I went through this last death of my family, the first thing I did was rush home and go right to my dog. Right? To make me smile. So it really can help. But you can also reach out and try to stay connected by volunteering. We at Act-Now Foundation happen to love volunteers. Right? And the good thing about volunteering for a nonprofit is you're also giving back. So that also gives you a feeling of fulfilling a purpose, which is important. Find meaning and purpose in life. Like I just said, okay? Adopt healthy habits. Again, I'm always reiterating the importance of exercise, sleeping right, eating right, okay? We've got to reiterate those healthy habits. It's not easy, but it can be done. And I always say, don't kill yourself. Start in moderation. And not every day you're going to be perfect, and that's okay. It helps, yeah. And then if you know, it's about also knowing when to reach out for help, right? And in conclusion, just sort of to recap everything we talked about, depression is a serious mood disorder. Let's not confuse that, okay? Let's not underestimate the chronic, how severe depression can be, and that we do need help. It's not a normal part of the aging process, okay? It's not. It can be caused by many different things, which we discussed. We always need to pursue medical help if we need to. Okay, a healthy lifestyle changes are definitely beneficial, as we talked about. Check in with your friends and family, and at the end of the day, you talk to your doctor if you need to. Even your regular intern doctor. Okay, they can help find. And if you need help, we at Act-Now, we consider ourselves a dementia resource center, but we have resources in all areas. We know there are programs that you can go to. So if you or someone you know is looking for help, mental health help, we do have people that we work with. We have agencies that we work with that are wonderful. Agencies that you pay on a sliding scale. Agencies that are free for the first 30 days, you know? So there's help out there, and just, you can always feel free to reach out to us. All right. And besides the resources that we can help, any one of you who are interested, if you're over the age of 60, we do offer free cognitive screenings. I know we've kind of talked about this before. We're not doctors, we don't diagnose. However, we do provide a baseline assessment of whether your cognitive decline is a normal part of the aging process, or if it's something you should be more concerned about. Okay, so sort of we're a great first step for someone who's concerned. Yeah.
Do you know about the sports people, the
Oh, yeah.
injuries?
Oh, yeah.
Everyone in Newark did sports. Everybody in Jersey is sports.
I know.
Is
It's
that like?
100%.
You guys know about that?
Oh, yeah, they're traumatic brain issues. It could cause Alzheimer's disease, it could cause chronic encephalopathy. It can cause many, many things, so it's very concerning. Muhammad Ali, boxer,
You didn't
constantly
mention
hit the
that,
head. Yeah, I mentioned that. So yeah, it's very
Something to
concerning.
think about as
a parent.
They start acting different. I'm like,
Yeah,
sports.
yeah, no, definitely, yeah.
Okay.
And we also do support groups. So anyone who is taking care of somebody who has dementia, we do support groups. If you're looking for a support group for mental health, we can help you find one of those as well. Okay. We do these educational series. I think, Steve, what am I doing next week? Oh, you've got, I'm doing fleet. I love it. I can't wait to talk about sleep. You know what I'm gonna do? Tempted to bring in mats. We're all gonna take a few minutes and learn how to try to fall asleep. What do we think about that? You just have to promise me you're gonna wake up and listen to the rest of the seminar. Anyway, so these educational series are really important for us as a nonprofit organization, and we provide them. So we not only train older adults, we train caregivers. I also do a very large training for first responders. So I'm a consultant with the County of Hudson and with the County of Passaic to provide training for their first responders. So that's a really big, really important issue for us.
These courses or these.
Yeah.
Because I believe the one that you guys came in and did was,
6 Pillars of Brain Health.
yeah.
Yeah.
Would there be a way that I could get someone to come into the building to give them an academy, but don't think it would have to be in Spanish?
Yeah, that will be Carrie. So Carrie does all the trainings in Spanish. I think she's the one that did it in your building. Yeah, absolutely. Yeah. This is a great volunteer opportunity. We have a huge brain health and wellness fair every year. We did just have it already in June. It's every June, but we have about 500 people there. We have a whole team of volunteers. We also have a gala coming up. I wonder if I put it in here. I did. So we have a gala coming up. We have one big fundraiser at the year in December 8th. So we're also in need of volunteers for our gala that night too. So if you want to, but we do have one. It's at the Venetian in Garfield. It's a big, beautiful night. It's the only time that we raise funds in the community. But okay, does anyone have any questions? No? You guys were, yeah.
Real depression, that's more of a chemical, like a biological, it's not like I had a bad day, that's like.
No.
You can't really function.
Yeah, that's not chronic depression at all. I mean, a chronic depression is something that can, like you talked about, it could be caused by medical, it could be caused by illness, it could be caused by genetics. So it could legitimately be a mental health issue. So that's why it's important that we go to the doctor to get checked. It's a real issue. We have to figure out what it is. What's causing it?
My grandmother, I believe, depression, the family is totally hereditary. Because my grandmother went from
It is.
like 150 pounds, in a matter of like 8 years, from 150 pounds to 72 pounds. And it went from her getting up and going to the adult daycares, going to her doctor's appointments, participating in church activities, and
And then
then
nothing.
waking up, getting dressed,
Yeah.
and sitting in the bathroom.
Yeah. Yeah, absolutely.
That's chronic depression?
Yeah. And she developed it later in life, that she was probably also towards the end suffering from some form of dementia as well. Because of,
And I know she had like really bad, when even it started really young, started practice.
yeah. And see, so there's a physical ailment that could have caused the depression to begin with. She wasn't able to do everything she was able to do before. That can be the cause of chronic depression. So yeah.
I think that's what my favorite
Yeah.
is.
Yeah. So I just want to mention everybody on your folder, you can do a folder. Inside these folders that you have are a lot of educational material. For those two, for the two of you that came in a few minutes later, if you wouldn't mind, you have an intake registration form, front and back. You could just fill it out and get some basic information. Only because we provide this service free of charge because we're funded by the county. So I'm going to provide this and then sign the back. That'll be great. And then also you'll see an Alzheimer's prevention education project evaluation form. So that's just to tell me how fabulous or how much I suck. Okay, so please fill that out. You don't, it can be anonymous. You don't have to fill in your name. And then just make sure you send it back to me. We also have a couple of books over here that can be really helpful. There's books on social isolation, on depression, and there's one on dementia. So please make sure you stop by over there. My business card is there if you need it, our brochure, the nonprofit, everything that we do is actually there's a copy here in your book. There's also much educational material on Alzheimer's disease, the stages, and all kinds of information that you might need to find helpful. This is for you to take home. Okay. Thanks again. You guys were great.
Yeah.
I'm so happy you had great questions.